All right, now we'd like to move on to the new guidance on breast cancer screenings. Women as young as 40 should get a mammogram every other year, according to the U.S. Preventative Services Task Force. That is a full decade earlier than the prior recommendation of 50 years old. The independent task force says changes in cancer rates led them to update this guidance. So I'd like to welcome in Dr. Erika Hamilton, Director of Breast Cancer Research at the Sarah Cannon Research Institute. Dr. Hamilton, thank you so much for being with us. Obviously, this is a topic that I'm very passionate about. What are your thoughts on these new guidelines? First, let's focus on lowering the age of recommended screening back to 40.
Yeah, so I think it's important to note that this actually brings in the U.S. Preventative Task Force recommendation more in line with other agencies. The American Cancer Society, for example, as well as the American College of Radiology, already recommended women begin mammogram screening at 40. But you are correct in saying that the previous recommendation from the USPTF was 50 in every 2 years. I'll also note that the other organizations do recommend 40 and yearly, which is still a difference between the USPTF recommendation.
Well, and that's, Dr. Hamilton, what I wanted to ask you about next, because what do you think about this recommendation that it happened every 2 years versus annually?
Yeah, the USPTF really focuses on preventing people from dying of cancers, right? And so sometimes this doesn't take into account the importance of catching cancer early, where cancer treatment may not need to be intensive. So I think many of us that treat patients facing breast cancer really do believe strongly that patients should be getting mammograms every year. So we have the highest chance of finding cancers when they're earlier and they're easier to treat.
You know, and this next question is so important. There are plenty of people who say that these recommendations don't go far enough, Dr. Hamilton, because the panel declined to recommend extra scans for women with dense breast tissue. That is me. My mammogram was fine. I had the all clear. I have no family history. I was not at high risk. My cancer would not have been found if not for that additional screening I opted into. So shouldn't that also be recommended?
You bring up a really good point. We know that dense breast tissue, we're more likely to see cancers. We're more likely to have those missed on mammograms. Just recently, actually, it was required that breast density be disclosed on all mammogram reports. So I recommend, based on that, having an individual conversation with your doctor. There are other screening tests for patients that have particularly dense breast MRI, for example, that we can use in conjunction with mammograms.
And what is your recommendation, or what do you tell patients who do get the all clear, as I did, for a mammogram, but yet may still have cancer and don't opt for those screenings? How important are those additional screenings?
Yeah, it's tough because each person's risk factors and thus their recommendations really are individual. So I certainly do think that people should be starting mammograms at 40 at the latest. It's important to note that there may be some people that our recommendation is even earlier, based on family history, based on genetics, based on previous cancers or radiation. And then certainly with the density and how those mammogram images look, there are patients that we do recommend doing additional tests such as a breast MRI that can see within dense breasts a little bit easier as well.
Yeah, I am a huge cheerleader for screening because, again, no family history, not high risk, in my 40s, and boom, here I am. All right. Dr. Erika Hamilton, thank you so much. Really appreciate it.
Thank you.
Thank you for watching. Go to NewsNationNow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.